So what are the steps to getting all-on-4 treatment? We always offer complimentary discussion visits for patients to just find out more information. And what that does is it gives us an idea of whether the patient is suitable to have all-on-4 treatment, and also to work out what the rough costs would actually be. If the patient has considered the costs and would like to look further into all-on-4 treatment, we will send them for a 3D scan. So we feel that it's important for patients to know whether it's possible to have treatment before they spend money on consultations. The cost of the scan is around about $305. When the scan comes back, we load it into our software system and we're able to plan the entire case. We're able to see, is there enough bone? Where are the blood vessels and nerves, and where should the implants go, and what type of implants and size of implants should we do in order to do all-on-4 treatment. If there isn't enough bone, then there's two options for the patients. Either it's a situation where we go back to traditional dentures, or it could be a situation where we may look at bone grafting in order to supplement the bone in order to be able to do all-on-4 treatment in the future. If there is enough bone, then we can definitely plan the entire case on the computer and we can write down an exact quote for that patient. If the patient is happy with that quote, that's when they organise appointments to get the all-on-4 surgery completed. The appointments that are most important is usually 1 or 2 diagnostic appointments, and what we do at this diagnostic appointments is collect data on the first visit, and data meaning we take models of the patient's mouth, we take photographs and videos. We then start to use those models and photographs, and really what we call it is 3D cloning or digital cloning of that patient. We use all of this information to plan exactly where the teeth should go and the smile should be and how the bite should be after treatment. When we've collected all that data on the first diagnostic visit, the second diagnostic visit is to test that. We sometimes need to have maybe a trial denture, or we may need to set up teeth in order to check, are those teeth right for the patient? Do they look right? Does the bite look right? Is there any changes that we need to make before we start doing any surgery? So those 2 diagnostic visits are very important to make sure that before we start any treatment or do any surgery on the patient, that we know what the final result's going to look like, and definitely that the patient knows what the final result's going to look like. From there, surgery date is actually booked, and on surgery date we of course will place the implants and take moulds of the patient's mouth. So that usually happens on a Monday. By Wednesday, we will have all the teeth set up in wax. So this is what we call the trial smile. So 2 days after surgery, the patient will come in and we will fit those trial smile teeth on top of the implants. The patient then gets to see exactly what the teeth look like and also check that the bite is 100% and even. The most important aspect too of this is not only that the smile is correct and the bite is correct, but that the phonetics are actually correct, so that the patient's pronunciation and words sound correct, and that's something that we can also test at this visit. On the Wednesday, what happens is that Patrick will then take that and convert it to the final all-on-4 bridge, and that gets placed in on Thursday. So between Monday and Thursday, the patient will actually go from having surgery to having a complete set of teeth by Thursday. The reason why we have so many steps is to make sure that the patient's final result is exactly what they expect when the final all-on-4 bridge goes in.